Hello from Liberia. Women, children, and adolescents in our communities tell us they need access to sexual reproductive health and rights information and services, gender equality, and protection from violence against women and girls. I am now going at the Ministry of Health to interview Dr. Wilhelmina Njala, who is the Minister of Health. So I'm here to ask the minister what she is doing about those issues.
How are you? Honorable Minister, it's an opportunity to see you again because we met in 2018 in Asia for the Primary Healthcare Conference and for a couple of youth occasions in Liberia at the Ministry of Health. I've also seen you, and it's an opportunity again to see you once more. As we talk about Liberia's commitment to the PMNCH call to actions, can you tell me about Liberia's commitment to invest in the health, well-being, and rights of women, children, and adolescents during this difficult time of COVID-19 and beyond?
Liberia, led by Your Excellency President George Weah, we in Liberia are committed to the challenge of protecting the progress in safeguarding the health and rights of women, children, and adolescents everywhere throughout the PMNCH COVID-19 call to action. With this endorsement, we reaffirm our commitments to achieve universal health coverage through improved primary health care. We pledge our commitment to action that will arrest and reverse the risk to women, children, and adolescent health well-being during this COVID-19 response and recovery, leaving no one behind. This is why we have allocated 30% of the COVID-19 2021 containment budget and addition domestic funds of over $4 million to improve the health and well-being of women, children, and adolescents.
My next question is, what are some of the critical gaps in care and social protection that you are seeking to address with this commitment that you've made?
You know, it's important for us to listen to our youth and work along with them. We are making efforts in improving the health and well-being of women, children, and adolescents. However, there are gaps in which are critical areas which funding seeks to address, and these areas includes enhancing providers' capacity to providing quality healthcare services for women, children, and adolescents, which is very important. Indiscriminately, we hope to provide quality wash facilities, including safe and accessible drinking water to all women, children, and adolescents. We also have to make sure that we empower adolescents with knowledge and skills to make informed decisions and be involved in their own healthcare and well-being. This is very, very important. We also want to enhance readiness of all of our facilities through ensuring availability of critical life-saving equipment and medicine to ensure access to quality health care for all of our women, children, and adolescents. Finally, we want to protect the women, children, and adolescents against sexual and gender-based violence through provision of quality forensic evidence, enhancing surveillance, and convicting the perpetrator. The president has taken a special initiative to appoint a special prosecutor to the government of Liberia to fast track all of these rape cases. And also, we have a special task force that composed of the Ministry of Gender as the lead, the Ministry of Justice, and the Ministry of Health and also Finance Ministry to make sure that we fast track any perpetrator that is caught in this violent act.
So thank you. Regarding the commitment Liberia has made so far, which government sectors will be prioritized as part of this new commitment? And then what role will they play in ensuring that women, children, and adolescents can safely access health services and social protection measures in Liberia?
So, government sectors, this is a multi-sectorial effort. You have to have many ministries that looks at women, children, and girls issues and adolescent issues. So take, for example, the Ministry of Health. We are responsible. We have a sexual and gender-based violence unit here. We have our nursing unit that look at all of the nursing issues concerning the girls. We have our family health division that looks at the family as a whole. So mostly it will be women, children, and girls that we will be concerned about. We have the Ministry of Gender and Social Protection that provides the safe homes and other support, psychosocial support for these individuals that are at risk. We have Youth and Sports that looks at critical needs, putting them together, making sure that they find job or they are at other institutions that provides training for them, making sure that we all keep them in line in what they are doing. We have education because they need to know how to prevent risky situations. So we need to educate them on all levels. Make sure not only the women, the adolescents, and the children are educated, but we got to educate the teachers and the principals to make sure people are safe. Labor can provide jobs and skills training for them. Justice Ministry is definitely there to make sure that if anything's happening, they are protected. You have the city corporation that works closely with youth empowerment and employment, and other line ministry, security sector. Every one of us are working together for this protection. Each of us have our unique roles and responsibility as mandated in our specific function that we have actually carved out and written down so that no one leaves anything behind. We have specific timelines and actions that we have to follow, and we meet monthly to make sure that we are on target. Therefore, we rely on all of the expertise to achieve this commitment.
Thank you, Honorable Minister. Then, with all of what you've said, what will be done to enable and support? What will be done to enable and support community-based monitoring and feedback of your commitments and further encourage community needs to be expressed?
To do anything, you have to have people that you are accountable to. So therefore, one of the people that are on the ground that we are always accountable to is the human rights group. Then we have the civil society, which is one of our biggest watchdogs that keep an eye on what we do.
Yeah.
We have other governmental and non-governmental agencies, churches, and other groups that are keeping a watch to see what we are really doing. Parents and other sympathizers are all out there also joining forces to keep an eye on what the government is actually doing. But most of all, the government has its own accountability framework that is being developed, and each government entity will be monitored and evaluated, and we will have to send a report to the president on what we have done.
Honorable Minister, will you kindly grant me the opportunity to meet with you in the next 6 months, maybe to have conversations around what we've discussed or more?
Definitely, you will be granted that. Even if you don't call us, we will definitely call you to give you an update, because it's important for you to bring that back to the women, the adolescents, and the children to make sure that we are working for them as a government.
Okay. So finally, to conclude this conversation, In 1 minute, can you summarize Liberia's commitment?
Well, Liberia is committed to the PMNCH COVID-19 call to action. We have made allocations of 30% and even more to make sure that things happen. We have addressed all of the gaps in collaboration with key stakeholders, which includes Ministry of Justice, Ministry of Gender, and the Ministry of Health. And we have now put together our accountability framework, which will include the civil society, all of our partners, and the government sector itself, leading to giving this accountability to the president. Thank you.